Good morning, everyone. Thank you for tuning in to Atlanta and Company. I'm Christine Pilara. The weather is heating up, and for many, that means hitting the pools and, yes, showing off some leg. For others, it means wearing long pants during the summer or cover-ups. Well, VEINatlanta's Clara Blackburn joins us this morning to tell us about a procedure to help those of you out there who might be suffering from varicose and or spider veins. And she's brought along very happy patient Tanya Arnold. Good morning to both of you.
Good morning.
Thank you for being here. So, Tanya, let's dive right in. Because nobody likes to hear a story better than someone who's had great success with something, and that's why we always like to turn to our testimonials here on the show. When did you first notice that your veins were developing? You had spider veins. Tell me the background.
Well, I was probably 14 or 15 when I first started noticing spider veins on my thighs.
That early?
That early. And I just thought it was normal because both my parents had them.
And anything else as you've gotten older in your 20s? Any other symptoms?
Yeah, I got more and more varicose veins as I got older in my early 20s, and they just kind of got worse and worse with time.
And now, I mean, you're a dance instructor, I read, so this really probably had to impact you, right? If your legs were just not feeling the way they should, and this is your profession, how was that for you?
Painful, tiring. By the end of the day, my legs would feel heavy, exhausted. The varicose veins, they would bulge and itch.
Yeah, I know. I have that too, which is why I'm going to see Dr. Bravasti, which we'll get to that in a minute. But Tanya, talk about, you mentioned something, that your parents had them too. So you seeing that, you thought, okay, well, this is just normal, and it is hereditary. But so finally, though, what made you say, all right, I am so uncomfortable, I'm going to do something about it?
I just couldn't get through a whole day of work anymore comfortably. I'd just be so tired. I'm like, I can't work like that every day. So I did some research online and discovered there were more options than back in the day when my parents were just getting injections.
And, you know, Clara, compression stockings can be worn to help that chronic venous insufficiency, but that shouldn't be the final outcome. Oh, you're just going to wear these stockings for the rest of your life.
Right.
So tell us more.
Yeah, compression stockings, they will help to alleviate pressure, but the ultimate answer is to get treated, and VEINatlanta does a great job of that. Everything's very minimally invasive. Technology has really come
a
long way. You know, we only use local anesthesia. You're in and out of the office in about an hour to an hour and a half. You know, treatments only take about 30 minutes. There's really not a lot of pain associated with the procedures. And, you know, we say recovery time's only about 1 week. With that, you can resume normal daily activities, including going back to work after the procedure. Just know, you know, heavy duty, working out, lifting weights for about a week's time. And you do see your results after that week.
And Tanya, back it up, like, because when you finally reached your, you know, breaking point, you said, I want to see a doctor. Why VEINatlanta?
I looked for the best vein doctor in Atlanta because my legs are very important to me. So I binged it, Googled it, did research on numerous websites, and Dr. Bravasti's website was the most informative, made me feel the most comfortable. He was obviously a heart surgeon for many years. I figured if he was that good, he could easily take care of my legs.
Exactly, exactly. And let's break it down, Clara, for people who aren't familiar with it. You know, you do offer so many different options, so kind of run through it, because you might be out there just suffering from spider veins, as I am, or it might get worse with the varicose veins, and you can treat it all and everything in between.
Yep. So if patients are not really sure what they have, or if they have just a couple cosmetic spider veins, they can come in for what's called a free screening visit. It's not done through insurance. They come in. We do give an ultrasound scan just to spot check, make sure nothing's going on. For spider veins, we offer two options. We do sclerotherapy. We use injections of a substance called polydocanol. This is much better than a more common substance called hypertonic saline. Saline tends to burn the patient, and we find that it's not as effective. So definitely go see a vein doctor that uses polydocanol. We also do surface laser treatment. Our surface laser treatment is done with a Dornier laser from Germany. It's the best treatment that you can get, very effective. And then we do offer a lot of different treatment options for the varicose veins. We do endovenous laser ablation. We do ambulatory microphlebectomies, and then we also offer radiofrequency ablation. And again, most of our procedures are covered by insurance. About 95% are covered, and we're in network with most insurance carriers, including Medicare.
Oh, that's fantastic.
Yeah.
Well, I like the part that when you go into the office initially, like as I did, that you actually look and they do the ultrasound on your legs, which I believe we have pictures. So there I am trying not to, you know, be nervous. And there was nothing to be nervous about. It's like when I was having my children. They did the ultrasound, and Clara, the doctor, found that I had just a low occurrence, or what's the correct terminology? I had a little bit of
venous reflux.
Venous reflux,
yes.
Turns out. So my blood was not flowing in and out, back and forth as well as it should. So then that helps them diagnose better as to what they need to do to me. So we're kind of getting started on treating my spider veins. And so for me, that wasn't anything that was, gosh, it was nothing. I mean, I was there on my lunch hour, came after work, so it was perfect. Talk about what you had to have done, though, Tanya. Give us a little bit of an idea of what you went through.
Actually, I had everything that she mentioned done, because I had a little bit more severe or moderate with each leg, different veins. So he had to shut down with the radio frequency, with the phlebectomy, and I can't remember what the other one's called.
Endovascular laser.
Thank you very much.
Yeah.
Yes.
Yeah, we're not doctors here.
Terms.
Yeah, we'll leave the medical terms to the doc, but the bottom line is, how are you feeling now?
I feel so much better. I have my energy back at the end of the day. I don't feel exhausted. I can move again like I used to, and I feel so much better. No more pain, no more swelling, no more throbbing legs.
Awesome. And how many treatments, how long did it take?
I had all the treatments done in December.
Within
a few weeks, really.
Yeah. And so that was it.
Yeah.
And so you were ready for spring, ready to go out, be in your bathing suit and your shorts this weekend, I imagine. And also in your outfits, right? Because as I mentioned, you're a dance instructor, Top Shelf Dance. So tell us more about that.
I'm in Norcross, Top Shelf Dance. I've been teaching here in Atlanta since '97 when I moved here. Awesome. And I do all forms of partnership dancing, ballroom, Latin, salsa, wedding dances, everything.
So yes, this was very important for your career, for the longevity of your career, and just feeling confident, because I'm sure when you get in your costumes and so forth, you know, you want to have that feeling that, you know, you're not worried about how something looks or feels, so you can just go ahead and do your dances and not even think about it.
But you've seen Dancing with the Stars.
Oh, yeah.
You don't always have a lot of clothes on.
No, you sure not. And I did a competition once, and I was like, this is all I'm wearing? This skimpy little thing? So now you are ready to tackle that and everything else, correct?
Yes, I feel I can be confident again. I don't have a bulging vein sticking out. So.
Oh, that's awesome. Clara, thank you so much.
Thank you
Always
for
so
having
great
us.
to see you. And thank you for your time. We appreciate it. And if you would like some more information about Vein Atlanta, give them a call. It's 404-446-2800, or visit their website at VEINatlanta.com.